Hello. Today, Crystal Cole and I will be discussing critical collaborations to have on your campuses in order to provide low-cost strategies for reducing mental health stigma and enhancing the student-athlete well-being on your campuses. I'm Danielle Rosario Cushion, the Assistant Vice President for Student Life at Upper Iowa University.
And I am Crystal Cole. I'm the Assistant Dean Director of Counseling and Wellness at Upper Iowa University as well.
So today you're going to receive resources that can be added to your campus collaboration toolboxes. You'll be able to identify strategies for how to present to administration with statistics on strategies to support long-term, cost-effective cross-campus collaborations for mental health awareness and prevention, and how to use online resources to identify strengths and challenges of your athletic department staff with regards to supporting student-athlete well-being. You can also expect to identify key campus experts who can engage in collaboration in order to educate student athletes, coaches, and athletic trainers. The folks to make sure you have these collaborations with are your counseling department, head coaches, assistant coaches, and don't underestimate your GAs as well. Athletic administration from the top down, your athletic training staff, your SAC, and your student athlete leaders. Many of us will have a student athlete mentor program, and those are definitely the student athletes who you want to tap into.
So as Danielle and I go through this today, we're going to cover each one of these groups and how we've collaborated with them, and just so that you can all get a good idea of how you can incorporate other departments and other areas into your programming.
So you all know this did not happen overnight for us. It started in 2016, and we're going to walk you through how we were able to get to where we are now in 2021. In 2016, I attended a mental health panel at the NCAA convention and learned about different ways to work with athletic training and counseling in order to assess the mental health of your student athletes and connect them to resources. In addition, that year, I attended the mental health first aid certification that was offered at our university that Crystal Cole had actually put on and organized. And there were several staff members across the university, faculty who were also certified, both for adult and children first aid mental health. Then in 2017, working with Crystal Cole and our head athletic trainer, we looked at different low-cost screening in order to combine with the physicals that the student athletes do with athletic training. And we also worked together on the bystander intervention trainings. Now, for those, we actually leveraged our student athlete mentors, or SAMs. They were trained in bystander intervention, and then they brought those trainings to their respective teams. We found that to be really helpful because it wasn't, it was more of a genuine conversation that they were having with their teammates. And also we applied for the Apple Institute and were accepted. And at the Apple Institute, we were able to send several of our student athletes and Crystal Cole, and they assessed where we are with our education and awareness around alcohol, tobacco, and other drugs. And from there, our student athletes decided that they were going to work on making our student athlete handbook more consistent. They had found that essentially the repercussions for alcohol, tobacco, the getting in trouble was very different sport to sport. And so they wanted it to be more consistent, and they came up with the 4-3-2-1 policy. They worked together with other student athletes for that policy. The 4-3-2-1 policy is 4 strikes for tobacco, 3 strikes for alcohol, 2 strikes for drugs, 1 strike for steroids. And they brought it to the SAC. SAC approved. We as administration actually found it to be a little too, their initial one, a little too stringent, and had them go back to the drawing board. They then made it a little bit looser, brought it back to SAC again, and then that was approved. So it's in the words of the student athletes. It's the policy that they wanted to come together and bring forward. And so that's what we have now. And then in 2019, our conference office started the Green Bandana Project. And with that, student athletes table at the student center. We have green bandanas that we're fortunate our conference office does get about 100 of those if upon request for the year, but they are available also at low cost. They table at the student center in common areas, and essentially students sign a contract saying that they're support for someone who's in need. And it's just symbolically, it shows that I'm here for you. I've been through something, or I know that, or I'm just a person that you can talk to. And they wrap these green bandanas on their backpacks or their duffel bags. So that was implemented together with SAC. Actually, I'm also going to go backwards. We started doing a mental health panel that's in 2016 with our SAC. That's completely SAC led. The student athletes go back to their teams, the SAC reps go back to their teams, come up with questions that they have for the panelists, and the panelists consist of coaches and our counselors and student athletes. So we usually get 2 coaches, 2 student athletes, and one of our counselors to serve on the panel. And it's all freshmen are required. It's open to all student athletes, but the freshmen are required to attend that. And then the questions come from each of the teams. So that is done every year. And then in 2019, that began being done in tandem with the Green Bandana Project. In 2020, we started working with coaches on essentially doing these anonymous case studies. And that was simply Google Docs, free Google Docs that was sent out to all coaches. Google survey. They all completed it, answered the case scenarios in the way that they would respond to a student. And we picked cases or created these cases that were very similar to things that we know coaches have dealt with in the past. And the reason we did this was because we saw that some coaches were having trouble finding that boundary between coach and counselor. And so after they completed that survey, COVID hit. And so we wound up not coming together until the summer before classes did resume in person, but later that summer in August, together to go over the case scenarios and then walk through the best way to respond and really things not to do. Again, to just help them understand where to draw that line. And then also what started this year was meeting with a counselor during those initial athletic training screenings. So I'll have Crystal talk a little bit more about that and also touch on any other areas that I may have missed.
Yeah, and I know we'll kind of dig into these a little bit too with the meeting with the counselor. So we've kind of worked with athletic training extensively, at least since I've been here, as far as like, how can we get a touch on all the athletes and see where they're at, where are they at mentally coming into the year, not just freshmen, or incoming, but also returners. And so that was one of the things that we did was we decided we really wanted to do some type of a screening with them, an assessment for anxiety and depression, and then some alcohol and drug assessments. And so our athletic training, our head athletic trainer was really good. They're very accommodating to us as far as like, hey, this is a good time to partner with it. We see all of the student athletes coming through. And so this would be a really great time. And so we were able to piggyback onto their initial screens. Every year, all of the athletes go through athletic training assessments or screens, I guess, like concussion screening and making sure their paperwork's all in. And so we were able to piggyback onto that with a designated space and designated time that student athletes would make it through our station as well. And so we were able to work with all of them at the beginning of this year.
So as I said, the student athlete mental health panel, the mental health first aid certification, steps for engaging the student athletes on the mental health panel. As I mentioned, it's required for all freshmen, but getting your SAC to take the lead on it is critical. Working together with your counseling office is also really important because it brings the counselors outside of their office to where the students are meeting to have this discussion. Also, getting the questions directly from the teams, again, critical because it it's going to bring their attention to the panel. Also, we have gotten our SAC and our student athlete mentors, or SAMs, certified in the mental health aid for first aid. It's very low cost, and Crystal will talk a little bit more about how you can make that low cost if you have someone on staff who is certified to give that certification to folks. But we've also gotten our coaches, head coaches, GAs, administrative staff certified, athletic trainers certified in the mental health first aid certification, but having those student athlete leaders certified as well. One, it's a resume builder, it's a 3-year certification, but it also helps them with identifying when someone may be in crisis and those strategies to respond to someone who's in crisis and who's not in crisis. Things to consider are the dates, times, offering food. For the mental health first aid certification, that's a long day. So we've had to split that up into 2 days. It's an 8-hour day, but to get 8 hours from your student athletes between practices and contests and schoolwork, obviously, is quite the challenge. So we've split it. And what we found is splitting it into 2 different weekends. So Sunday afternoons or Sunday mornings helps out best. Having some kind of donuts or snacks for them to eat also. And again, providing several options for them to attend and get that certification. For coaches and athletic trainers, a little bit more flexibility with the time, but also considering the all day may be a big challenge, so it may have to be split. And then the importance of getting that top-down buy-in and showing the data, showing the importance of getting this certification, the results of that. So the top-down buy-in, it's really critical to get your top administrators on board with this. But the way to do that really is to show them the money, really, show them where the cost savings is and the benefit of it. So the Apple Institute, the Apple Institute is something that everyone can, divisions 1, 2, and 3 can apply for. I'm not sure for NAIA, but perhaps there's something similar to the Apple Institute. Again, it gets you to internally look at your systems in place, analyze how often are you educating students on alcohol, tobacco, and other drugs. And other than just like providing the student athlete handbook, how often are you actually walking them through what your rules are? Bystander intervention, train the trainer. That again, it's several hours of training for I would recommend student athlete leaders and some coaches, because it's important to recognize that while some teams, for example, softball, their leadership, student athlete leaders may have a lot of respect on the team and then can get all the women together to pay attention and take this seriously. Might be a little bit harder for a team as large as football, for example. And so you may want to get some coaches who are also trained in that. So that way it could be a coach and a student athlete who are co-facilitating, and maybe they're co-facilitating with certain positions to break it up, because you do want to do it in smaller groups. So that way they are having a conversation and taking it more seriously. Student-led code of conduct. Again, when you go back to the students and essentially they want to argue about the student athlete code of conduct, you can talk about how this was actually student athlete led completely, and then just approved by the administrators, and again approved by the student athletes. So student athlete led, brought back to the student athletes via SAC, approved by them with the support of the administration. Collaboration with counseling, athletic training on mental health screenings, as Crystal talked about, and Crystal talked about a little bit about that importance of the private location and the time. But I will say that this year I did have student athletes telling me that they'd never seen a counselor before, but during their screening met the counselor and it was offered as an option, and they thought, sure, why not? And they found such a benefit out of it. So even students who aren't struggling with anything, never considered using counseling, are now using it and finding that benefit of it. So it's just a really good touch point with the students, even the ones who, before crisis hits.
Yeah, and I think one of the things with those screenings is, as Danielle just mentioned, it was definitely for people who are maybe on the fence about, getting some counseling, maybe some people who didn't recognize that the things they were feeling and going through could actually fall into certain categories, and maybe they could get help with that. The other and we never, when we did our screenings, we said, hey, here's our information. If you'd like to set up an appointment, we can do that. We didn't force anybody to come into counseling at that point. We left that kind of open, but we were able to put a face with a name. And so they could know who we were and where we're located and how to get in contact with us. The other thing that came out of that, which was also very interesting, was that we had a lot of friend referrals, like, hey, I have a friend who is going through this, or they went through this last year. Is that something you guys can help out with? Absolutely. And so we were able to get a lot of that. Hey, if this happens again, give us a call, come on in. We're happy to work with you. We're happy to do a consultation and talk through some things. And so that was one of the big things that came out of the screenings for all athletes, was that even athletes who maybe didn't need our help at that time, or in the future, maybe they will, but they also could recognize things in their friends that, hey, you're right, like I could come with them, or I could do this too. So that was always helpful too.
Here are the examples of the case studies that we provided the coaches, so you can get an idea. Again, just common situations that we saw coaches dealing with among their student athletes. So I'll read just a couple of them out loud for the sake of time, but Jane is struggling in a class. You know from her progress report that she has missed several classes, has not turned in one homework assignment, and got a D in her first exam. You bring Jane in to speak with her. She explains that she does not like her professor and feels the professor treats her as if she's stupid. What do you advise, Jane? I'll skip down. One day at practice, you notice that Jane has scars on her leg. You ask her about them, and she says that she used to cut herself when stressed. Walk through the rest of your conversation. So you can see it's very open-ended, leaving it to the coach to decide how would they respond in these situations. Crystal, is there anything that you want to highlight from what you noticed in this and the conversation you had with coaches?
Yeah, I think the setup of situations is really important. And so Danielle did a really nice job when this Google survey went out to coaches of setting up situations that she knew about, or of things that were realistic scenarios that have happened or did happen, things she'd heard about from other institutions, things from years past in the counseling center that we said, hey, these are big issues. These are things to address. So I think that is one of the most important pieces, is to set this up very realistically for scenarios that have and do happen quite frequently, and not just the 1 in a million things, which are also important, but the continual things that happen to each of the teams is important as well.
Yeah, and you'll be able to identify where coaches may, and again, because it's anonymous, you don't know who, but you can have that conversation with coaches about drawing the line between coach and counselor, when they should really be now referring their student athlete to counseling, and also when they're blurring the lines between coach and friend, or becoming too much of a parent, too overly involved in their student athlete's life. I'll let you take over this one.
Sure. So we've covered this a little bit already, but this is just kind of the breakdown of what was done with the students in case people want specific names of assessments or anything. Like I said, we did the GAD-7, the PHQ-9, and the audit, and that's going to be an anxiety, a depression, and then substance abuse screens. And so we did it to get to know the athletes, put a face with the department, and know where students were at when they came into the year. So are students functioning really well? Obviously, COVID was a big thing at the end of last year and through the summer. And so this helped us get a really good base for, all right, we know they're coming in, everybody's a little leery. Are they going to compete? Are they not competing? Are they practicing? Do they get another year? And so this really helped us to know where some of those anxieties and the fears and the thoughts kind of were for students when they came in. Non-COVID years, if those ever exist again, same thing. It's going to give you a really good synopsis of where your student athletes are, as far as, and you can see kind of differences on teams as well. So you're going to recognize too, like teams that have been already practicing together may have a whole different dynamic than teams that have not kind of gotten together yet. Just super helpful, and probably one of the the earliest indicators that we may get for some of the student athletes. Things that we did learn about it though, time is a barrier. So the screens themselves, the way we did it, when the students went through the different stations, they stopped at like a concussion testing station. And then we were towards the end of their stops. And so what we did was we had two different people running, not different people, but we had two people sitting and running the station where they filled out the paperwork. They took the assessments quietly on their own in their own space. And then myself and another counselor would meet with each one of them individually. And those meetings don't have to be long. You just review the paperwork, you talk to them about their scores, let them know the resources. Here we are, this is who I am. And then if they have any questions or things, obviously if they answer a couple of the questions on the PHQ-9 a certain way, or if their scores are very high, you may want to do a really brief assessment at that point, like, hey, where are your thoughts at? Can you tell me a little bit more information? And that's why it was really helpful too, to have two counselors doing that, because very rarely were we ever both in a deep conversation with somebody at the same time. Usually it was get them, into our private room and then saying like, hey, here's what your scores are. Do you have questions? Do you know what this means? And then send them through fairly quickly. Staffing is an issue because we are a department of 2 counselors, which means that for the people proctoring the assessments, the student athletes never gave their assessments back to those people. They held on to them until we saw them. So they didn't have to share their scores with anybody. But we did have 2 people sitting at the table in there to make sure that that process was going smoothly. Because if we took our time to sit out there as well, then that would have taken longer for that. And then our students being honest, the way I guess I approach that is that maybe not. Most of them, we felt like we're being pretty honest with at least the anxiety and the depression screen. With the substance abuse screen, maybe not. Our biggest point at that time was not to look at everyone and say, hey, you have an issue or you have a problem. Our biggest concern at that time was to say, hey, we're here for you and this is who we are. We just want you to get to know us and we're people. We recognize that you guys are going through a lot of things right now, a lot of stress. And so our biggest goal was to just make that connection. And if we could help some people at that time, that was helpful as well. And then obviously a lot of benefits that we've seen from that. Danielle and I kind of mentioned those earlier. We've had so many students come in and just ask questions and say, what would you do? Or how do I approach this? Or does my friend need help? Or who do I call? And I think that's been one of the biggest benefits as well, is that we're not counselor people anymore. We're Crystal and Olivia. They know where to find us. They know they can come talk to us if they need to. And so I think that's been one of the best benefits, at least for our campus.
So if I'm not mistaken, the numbers showed that you and Olivia had already seen almost the same number of students by the middle of this year as you had the entirety of the year prior.
Yep.
So that, yeah, I thought that was really telling of the benefits of this as well.
And that's huge because at the beginning of this year, we were still following really tight COVID protocol. And so students weren't always on campus. They weren't always, face-to-face visits. And so our visit numbers, yes, doubled basically for one semester. And a lot of it was because people knew who to talk to. They knew where they could go and see somebody too. So, yep, that was big.
So as I mentioned here, just the green bandana, things to consider: the purchase of bandanas, the printing costs, the certificates. It's essentially just a contract stating that I will support, I am here to support and not judge. And then making it campus-wide, not just an athletics initiative. Having a common area on your campuses where you're having those contracts, giving out those bandanas, again, just providing that physical show of support for students is important. Purchase of bandanas is not expensive. The printing costs, in order to make that less, I would recommend just having the contract be small and then using a paper cutter. So you can print 4 slips of the contract. We actually keep the contract. So that's how we keep track of how many students have signed off on this contract. I've actually committed to being a support for someone. And everything else that I think I've already discussed, so we can skip to the next slide.
And the only thing I would add to this is that even though it's not just an athletics initiative, at least on our campus, athletics students or the student athletes had so much investment that it really made this blossom so fast, because they took it to non-student athletes, and the buy-in was a lot bigger because the student athletes were kind of helping, like, hey, this is a thing, we're invested in this too. And so I think that was one of the best promoters of that initiative. And then with the costs, I know we talked about mental health first aid, and now there's some different modalities for this. And so I became trained on this campus to do mental health first aid. And part of that is to get trained yourself. And so the cost for that is $2,000 for a member of the behavior for National Council for Behavioral Health. I'm not getting that name right, and I apologize for that. New instructor training is $2,000 for member, $2,200 for non-member. Now with COVID and the changes that we've seen, you can deliver mental health first aid in person, which is the 8-hour training. You can do a hybrid model, which is 2 hours of self-study for students or participants, and then 6 hours in person, or they can do it completely virtual. We have stayed more with the in-person and then the hybrid model, because for our campus and for our students and staff, that is what works better. Doing completely virtual, it's really hard to designate some of that time. And so we just want to be aware of that. In-person counseling department led screenings, that it took, what the athletic department did was they did the screenings from 3 to 5 each day for 2 weeks. And so we were to allocate our schedules as well. And our schedules indicate that the 4 to 5 o'clock hour is like a prep hour basically, or a closing hour. And so we don't take student appointments that hour anyway. And so that was really helpful for us that we could block off those last 2 hours of the day and do these screenings for 2 weeks. Counselor time, if you have more students, you may want to allocate more counselors to it. If you have less, obviously less. Printing is always a thing. And then the Google surveys, Danielle's talking about, those were free.
Yes, the Google surveys were free. And I would say lesson learned here, ask across your campus if there are other departments who have access to advanced survey tools. So when I moved over into student life, I realized that student life had access to Question Pro and could have done pretty advanced surveys using that. But the Google surveys, they worked. I did those for 5 years and they worked great.
And so then moving forward, we're going to, for mental health first aid, there are several grant opportunities. And our campus was just notified that we're going to be able to receive additional mental health first aid trainings because of a grant opportunity that another business was able to obtain. And so they're collaborating with UIU on that. SAMHSA grants, these are suicide awareness prevention grants, mental health awareness grants, DOJ grants. Just keeping in mind, yes, it's a really big investment for time as far as applying, but the payoff can be really helpful for especially small departments, small institutions that don't necessarily have all the funding that they need or they want to be able to implement some things. We just encourage you to always look at the grants.gov to see if there's something that would fit. Even a small grant can help you implement several programs. I would say throughout all of these, $10,000, even less, $5,000 could help you really go into a lot of depth with several initiatives. So thinking with that, screening with athletic training, we're going to continue to do that. We're going to try to continue to do that. At one point, we paid for I think it's called the WellMind now. It used to be an online screening tool that was anonymous, and we would have student athletes do it. That was $500 or so every year. And so we were not able to sustain that at our institution, but that's where some of these screenings came in person as well. And so if your institution can sustain it, that would be another way that you could implement those screenings. That would be virtually instead of necessarily having the paper pencil ones. But you could still allocate that time and have students take them virtually with you or in your proximity, I guess. The Green Bandana Project, same thing on the campus. It's continuing to go forward. Student athletes continue to lead that. I think Danielle can kind of mention that they partner this as well with that mental health panel at the beginning of the year. And then Bystander 2.0. So this came out of the Apple Institute as well. We take the MVP we use MVP for in the fall with incoming students, but student athletes said, hey, what's next? We need the next level. And so Bystander Intervention 2.0 is taking bystanders into upstanders. And so putting them into action. How do you intervene? How do you step in, and how do you make those changes? And so that is an initiative that will continue to go forward. SAC students and SAMs will continue to implement those with their teams. And then we'll keep doing wellness and awareness events.
So
And then-
here's just a list of resources that we wanted to share with you all that we just have been discussing throughout the presentation.
And the thing we implement with this too is that I don't pretend that we own these documents. These are things that we found online, helpful for us. So we're really hoping they'll be helpful for someone else. And it's a starting place. And so this may not be the only place that you can find a low-cost mental health screening. It's not, for sure, not the only place that you can find a Green Bandana Project school webpage. But these are just things that helped us kind of in our journey. And so when we post them here, it's not because we own the website, we don't anything like that. We're just trying to help promote things that helped us too. So
here's our contact information should anyone have any questions. And now I believe that we will have some time for questions. Thank you.